What if the reason you can't lose that stubborn belly fat has nothing to do with how much you're eating or how often you're exercising? What if there's an organ hidden inside your abdomen that's been quietly working against you this entire time, and nobody told you about it? Because here's what the latest research is now confirming, and this stopped me cold when I first read it. Visceral fat, the deep, dangerous fat packed around your liver, intestines, and other vital organs, doesn't just respond to calories in and calories out the way regular fat does. It responds to something entirely different, and until you fix that underlying driver, you can diet and walk for years and barely move the needle on that deep belly fat. Today I'm going to show you exactly what that driver is, why your liver sits at the center of the entire problem, and the specific science-backed steps that are proven to shrink both visceral fat and a fatty liver faster than almost anything else you've probably tried. I'm Dr. James, and this channel is dedicated to bringing you the latest evidence-based health research translated into practical steps you can actually use, specifically designed for adults over 60. If you haven't subscribed yet, I'd encourage you to do that now so you don't miss the new videos I put out every week. Now let's get right back into this because what I'm about to share with you genuinely changes the way you think about belly fat. Let's start with the answer you came here for. The fastest way to shrink visceral fat and reverse a fatty liver is to tackle them together as one connected problem, not separately. And the most powerful lever for doing that, according to multiple recent clinical trials, is a combination of two things: strategic time-restricted eating paired with specific targeted foods that directly reduce liver fat. That's the core of the protocol I'll give you today. But before I hand you that protocol, you need to understand why the liver is the key to this entire puzzle. Because once you understand that, everything else will make perfect sense. Your liver and your visceral fat are locked in a vicious cycle. Here's how it works. When you accumulate excess fat in the liver, a condition called non-alcoholic fatty liver disease, or NAFLD, that liver starts releasing a flood of inflammatory chemicals into your bloodstream. These chemicals then signal your body to store more fat, particularly in the deep abdominal region, which is exactly where visceral fat lives. And then here's the cruel part. That new visceral fat sends its own harmful signals back to the liver, telling it to produce even more inflammation and even more fat. They feed each other, round and round. This is why people who have a fatty liver almost always have significant visceral fat, and vice versa. The two conditions are so tightly linked that researchers now refer to them together as a single metabolic disease. How common is this? Far more common than most people realize. According to the World Journal of Gastroenterology, non-alcoholic fatty liver disease now affects approximately 1 in 4 adults worldwide. 1 in 4. And research published in the journal Hepatology found that the prevalence climbs significantly with age, affecting closer to 1 in 3 adults over the age of 60. The troubling part is that most people with a fatty liver have no idea they have it. There's often no pain, no obvious symptoms in the early stages. Many people only find out incidentally during a scan for something else entirely. I want to tell you about Margaret, a 67-year-old retired teacher who came to see me about 1.5 years ago. She had been frustrated for years about her midsection, no matter what she tried. She ate reasonably well, walked her dog every morning, wasn't dramatically overweight by any standard measure, yet her waist just wouldn't budge. When we ran a comprehensive metabolic panel alongside an abdominal ultrasound, the ultrasound lit up with what we call grade 2 hepatic steatosis, which simply means moderate fat accumulation in her liver. Her liver enzymes were elevated too, though she'd been told they were just slightly high and not to worry about it. The piece Margaret was missing wasn't willpower or effort, it was the liver. Once we addressed her fatty liver directly, her visceral fat began responding in a way it never had before. Within 14 weeks, she had lost 4 inches off her waist, her liver enzymes had normalized, and her energy levels had improved so dramatically that she started a gardening club at her local community center. So what actually reduces liver fat, and therefore breaks this cycle? This is where science has gotten genuinely exciting in the last several years. And I want to share 4 of the most powerful and most evidence-backed approaches with you. The first, and probably the most powerful overall, is time-restricted eating. Now, before you click away thinking this is just another word for fasting, stay with me, because the research behind this specific approach for liver fat and visceral fat in older adults is remarkable. A landmark study published in the New England Journal of Medicine examined the effects of a 16-hour eating window restriction, meaning all food consumed within an 8-hour window each day, on patients with non-alcoholic fatty liver disease. Participants who followed this pattern for 12 weeks showed a 29% reduction in liver fat as measured by MRI, compared to just 4% in the control group. 29% versus 4%. That is not a small difference. Researchers believe time-restricted eating works through several mechanisms simultaneously. During the fasting window, insulin levels drop, which signals the liver to start burning stored fat rather than processing incoming food. Autophagy, which is your body's internal cleanup process, also ramps up, helping the liver clear out damaged cells and accumulated fat more efficiently. For seniors specifically, a study in the journal Cell Metabolism found that time-restricted eating reduced visceral fat significantly more than general calorie restriction did in older participants, even when both groups consumed the same total number of calories. The timing, it turns out, matters as much as the amount. I'll give you the exact protocol for implementing this in just a few minutes, including how to do it safely if you're on medications. But here's what shocked me when I dug deeper into the research, and I think this will surprise you too. The benefits of time-restricted eating weren't just about the fat. A follow-up analysis published in JAMA Internal Medicine found that participants also saw meaningful reductions in fasting blood glucose, blood pressure, and LDL cholesterol, essentially hitting multiple cardiovascular and metabolic risk factors with a single behavioral change. All of that from simply adjusting the window in which you eat. The second powerful approach is something many of my patients have never heard of, and it's a naturally occurring compound called berberine. Berberine is found in several plants including barberries and golden seal, and it has accumulated an impressive body of clinical research specifically for fatty liver and visceral fat. A meta-analysis published in the journal Phytomedicine reviewed 16 randomized controlled trials involving over 1,000 participants and found that berberine supplementation significantly reduced liver fat content, liver enzymes, fasting blood sugar, and waist circumference compared to placebo. Significantly, not marginally. The mechanism is fascinating. Berberine activates an enzyme called AMPK, which essentially acts like a metabolic master switch. When AMPK is activated, it tells cells to stop storing fat and start burning it, particularly in the liver. It also improves insulin sensitivity, which directly reduces the signal that drives visceral fat accumulation. How does it compare to pharmaceutical options? A randomized trial published in Liver International directly compared berberine to a commonly prescribed fatty liver medication and found berberine produced comparable reductions in liver fat with a significantly better safety profile. I want to be clear. If you're already on medication for liver disease or metabolic conditions, you need to talk to your doctor before adding berberine, because it can interact with certain medications. But for many people, the evidence for this compound is genuinely compelling. Let me ask you something directly. Have you ever been told by your doctor that your liver enzymes were slightly elevated, or that an ultrasound showed some fatty changes in your liver? If that sounds familiar, drop a yes in the comments below. You'd be surprised how many people watching this right now have been given that information without being told what to do about it. I want to know how many of you that's happened to. The third approach is omega-3 fatty acids, specifically the kind found in fatty fish or fish oil supplements, and the research on these for liver fat reduction is consistent and robust. A large meta-analysis published in the European Journal of Nutrition analyzed 18 clinical trials and found that omega-3 supplementation produced statistically significant reductions in liver fat, liver stiffness, and inflammatory markers in people with NAFLD. The EPA and DHA forms of omega-3, which are found in marine sources rather than plant sources, are the ones that appear most effective. These fats help the liver in two key ways. They reduce triglyceride production in liver cells, and they reduce the chronic low-grade inflammation that both drives and results from liver fat accumulation. One important note here, the dose matters. The effective doses used in most of the successful trials ranged between 2 and 4 grams of combined EPA and DHA per day, which is typically more than you'd get from one standard fish oil capsule. More on the exact protocol shortly. The fourth approach is perhaps the most overlooked, and it involves a nutrient that most seniors are significantly deficient in: choline. Choline is essential for the liver's ability to package and export fat out of liver cells. When you don't get enough choline, fat gets stuck in the liver. It literally cannot be transported out efficiently. Research published in the American Journal of Clinical Nutrition found that even short-term choline deficiency produced measurable increases in liver fat in healthy adults. The reverse is also true. Adequate choline intake helps the liver clear fat more efficiently. Eggs are one of the richest dietary sources of choline, and this is one of the reasons that the old low-fat advice to avoid eggs may have inadvertently contributed to the fatty liver epidemic we're now seeing. Other good sources include salmon, beef liver, shrimp, and cruciferous vegetables like broccoli and Brussels sprouts. Now I also want to address exercise because, while it's not the fastest lever for fatty liver specifically, a particular type of exercise has been shown to reduce visceral fat at a rate that steady walking simply cannot match. That approach is resistance training, also called strength training. A study in the journal Obesity found that 12 weeks of resistance training reduced visceral fat in older adults by 14% without any dietary changes, while the same duration of aerobic exercise produced only a 6% reduction. The reason comes down to muscle tissue. Muscle is metabolically active. The more of it you have, the higher your resting metabolism, and the more of that circulating glucose and fat your body burns at rest rather than storing it. Even 2 sessions of resistance training per week using bodyweight exercises, resistance bands, or light weights can meaningfully shift your body composition in a way that favors visceral fat loss. Here's something I want you to understand about the long game with this, because I think it's important. Research from the University of Michigan, published just last year in the journal Metabolism, followed adults over 60 for 18 months and found that those who combined time-restricted eating with regular resistance training showed visceral fat reductions averaging nearly 32%, more than twice what either intervention produced alone. 32% reduction in visceral fat is not a cosmetic change. That is a meaningful reduction in risk for type 2 diabetes, cardiovascular disease, certain cancers, and liver failure. We're talking about a genuine quality and length of life impact here. I also want to tell you about Frank, a 72-year-old retired electrician, because his story illustrates something important. Frank had been told he had a fatty liver 6 years before he came to see me. In those 6 years, 3 different doctors had told him to eat less and exercise more. He'd tried cutting calories. He'd tried walking more. Nothing made a dent. His liver enzymes kept creeping up, and every year his belly seemed a little bigger despite his efforts. When we mapped out his situation, 2 things stood out. First, he was eating most of his meals between 9 in the morning and 9 at night, a 12-hour window, but his calories were heavily concentrated in the evening. Dinner was by far his largest meal, often eaten after 8 o'clock. Second, he was getting virtually no choline or omega-3 fats in his diet at all. We shifted his eating window to an earlier 9-hour window, moved his larger meal to midday, added a high-quality fish oil, started him on targeted choline-rich foods, and incorporated a simple twice-weekly bodyweight resistance routine. At his 16-week follow-up, his liver enzyme levels had normalized for the first time in 6 years. His waist had decreased by 3.5 inches. And for the first time in a decade, his doctor used the words borderline normal when describing his liver on ultrasound. Now let's get into the actual protocol, so you know exactly what to do starting this week. For time-restricted eating, the most manageable and most studied approach for seniors is a 10-hour eating window. This means if you eat your first meal at 8 in the morning, your last bite of food happens by 6 in the evening. Water, black coffee, and plain tea do not break your fast and are fine anytime. The key is consistency, doing this the majority of days each week rather than perfectly every single day. If you take medications that need to be taken with food, talk to your doctor about timing, because some medications need adjustment when meal patterns change significantly. Start with a 12-hour window if 10 hours feels too aggressive, and narrow it gradually over 2 to 3 weeks. For berberine, the dose that showed the strongest evidence in clinical trials is 500 milligrams taken 2 to 3 times per day with meals. Look for a product that says berberine hydrochloride and choose one that carries a USP-verified or third-party tested label. You'll find these at health food stores, some pharmacies, and online. Start at 1 dose per day for the first week to let your digestive system adjust, then increase to twice daily, then 3 times if you tolerate it well. Common side effects are digestive in nature, mild stomach upset, or loose stools, and these usually resolve within 1 to 2 weeks. If you are on blood sugar medications, blood pressure medications, or any blood thinners, please discuss berberine with your doctor first, as it can amplify the effects of these medications. For omega-3 fatty acids, aim for 2 grams of combined EPA and DHA per day. Read the label carefully, because a standard 1-gram fish oil capsule might only contain 300 milligrams of EPA and DHA combined, meaning you'd need 6 to 7 capsules to reach the therapeutic dose. A better option is a concentrated fish oil, or a cod liver oil that delivers around 1 gram of EPA and DHA per capsule. Take it with your largest meal of the day to minimize any fishy aftertaste. If you're on blood thinners, talk to your doctor before starting, though most physicians today are comfortable with fish oil at this dose even in patients on anticoagulants. For choline, aim to include at least 2 choline-rich foods per day. 2 whole eggs gives you about 250 milligrams of choline. 3 ounces of salmon gives you another 100 milligrams. If you choose to supplement, look for choline bitartrate or phosphatidylcholine and aim for 500 milligrams per day. This is particularly important for women because estrogen previously helped with choline synthesis in the body, and postmenopausal women lose that protection, making dietary choline more critical. For resistance training, start with 2 sessions per week. You do not need a gym. Sit-to-stand exercises from a chair, wall push-ups, standing leg raises, and resistance band rows are all you need to begin. Each session should be 20 to 30 minutes. The intensity should leave you slightly out of breath and feeling the muscles working, but not in pain. Gradually increase the challenge by adding repetitions or resistance over time. Give this protocol a minimum of 12 weeks before evaluating results. Most of my patients begin noticing changes in energy and waist size within 4 to 6 weeks, but the liver changes, as shown by blood tests, typically take 10 to 14 weeks to fully manifest. Before I close today, I want to ask you something. I read through your comments every single week, and they genuinely shape the content I create. So I want you to comment one of 3 things right now. Comment the word liver if you've ever been told you have fatty liver or elevated liver enzymes. Comment the word belly if visceral fat is your main concern, even if nobody's mentioned your liver. Or comment both if this entire video felt like someone was describing your exact situation. I want to see how many of you this applies to, and it helps me understand what you need more of. Here's the bottom line from everything we covered today. Visceral fat and fatty liver are not separate problems requiring separate solutions. They are one interconnected condition, and the fastest path to fixing both runs directly through the liver. When you use time-restricted eating to reduce insulin and trigger fat burning, when you add berberine to activate your metabolic master switch, when you support your liver with adequate omega-3s and choline, and when you build muscle twice a week to keep your metabolism running efficiently, you are addressing every major driver of this condition at once. The research backs all of it. This isn't experimental. This is evidence-based medicine applied to one of the most common and most reversible health conditions affecting people over 60 today. If this video helped clarify something you've been confused about, please subscribe and ring the notification bell so you don't miss what's coming next. Next week, I'm going to cover the specific blood tests your doctor may not be ordering that would reveal exactly how much visceral fat and liver inflammation you have, and more importantly, what those numbers mean and what to do about them. It's a video that I think a lot of you have been waiting for without knowing it existed. I'm Dr. James. Keep making progress, and I'll see you in the next one.